Hi, my name is Kendrick Allen. I'm coming from Pointe Counseling, an outpatient facility on the outside of Atlanta, about 10-15 minutes from downtown Atlanta. Today I want to talk about anger and self-forgiveness. Anger is a very dangerous emotion to learn how to manage in early recovery. If you think about all of our emotions we have, this is the one emotion that tend to get many of us into trouble and problems. This is the one emotion we learn how to disconnect from and how to not manage, and even how to feel. I remember many times growing up, you might hear a parent say, don't be angry. If you get angry, you're going to get a timeout. So a lot of times we're punished for expressing our anger. And so we want to look at anger from three different aspects and in early recovery. And sometimes people would want to express anger in a real passive way. That means that they keep the anger on the inside, they keep the peace, they keep it stuffed away, they numb themselves and they disconnect from the feelings of anger. Sometimes you will have someone who's very passive, aggressive with expressing the anger. That means that they're going to keep the aggression on the inside and on the outside very passive. So they would say, I'm okay, I'm fine, I'm feeling okay, don't worry about it, I'm not upset. But inside there's a storm brewing. But this one here is going to express the anger, but in a very passive aggressive way. So they may tend to hold grudges and get back at that person or that situation within a week, maybe even 2 weeks, and the person won't even know that they're getting revenge. The third way, obviously, is the aggressive way. And this is the more common expression of anger. We see a lot of rage, verbal abuse, physical abuse, throwing something, hitting something, and hurting others, invading someone else's boundary. We want to try to get everyone down to how can you become assertive, respecting boundaries of self and others, verbalize your feelings, get the anger out, learn to resolve it. Where does anger come from? My belief is that anger has a lot to do with grief. We're just going through losses or significant changes, and many addicts and alcoholics experience a significant amount of losses, but they don't even realize that they're going through a grief period for it. And anger is the third stage of grieving. We have the shock stage, the denial stage, and then the anger stage. And so this anger is normally towards self, others, sometimes even angry towards God or the higher power. I'm a nice person, I'm kind, I'm loving, I'm giving. Why do I have to go through this? Sometimes we get angry at the illness. It's very often you hear patients say, I hate my disease, I hate the fact that I'm an addict, I hate the fact that I'm an alcoholic. And sometimes they even get angry at the losses. And the losses may be loss of health, loss of time, loss of closeness in my relationship, loss of trust, loss of dreams. I had to postpone my dreams because of my addiction, loss of money, loss of self-esteem, loss of self-confidence, loss of self-worth. These losses build up significantly, and it can cause someone to go into a phase of grieving, hence causing anger. And the anger is going to be expressed either passive-aggressively, or aggressively. And so how do we combat this anger? Some other ways you may see the anger being displayed or manifesting itself would be through self-attack, self-blame, self-harming, self-neglect, or just being very neutral. I'm not doing anything with my life, I'm not moving forward, I'm not setting any goals, I'm not advancing my job, I'm not advancing my education. I'm just neutral, I'm just not doing anything, I'm just withholding, and that's another form of self-attack. You might also have negative scripts, and that's the verbal attack. I'm no good, I'm worthless, I'm no good, nobody wants me in their life, no one wants anything to do with me. There's a whole lot of quality to my life, so a lot of self-loathing is going on. And how do you combat this significant piece of the anger when it comes to grief and loss? It's through self-forgiveness. So we spend a lot of time getting our patients to move towards self-forgiveness. How can I forgive myself for what I have done, for what I've done towards others, for what I have not done for others, and moving towards self-forgiveness. And this, I think, the self-forgiveness precedes forgiving others or accepting forgiveness from others. We have to do a lot of work in self-forgiveness, and that's an important way that we can start to go after managing our anger. Thanks.